I'm going to call to order this special called meeting for the Page County School Board. Can I have a motion to allow Mr. Lansbury to participate via the telephone?
Madam Chairwoman, I move that we allow Mr. Lansbury to participate via phone.
Second.
I have a motion by Mr. Gubler and a second by Dr. Painter to allow Mr. Lansbury to participate via phone. Mr. Gubler.
Yes.
Mr. Painter.
Yes.
Dr. Painter.
Yes.
Mr. Lansbury.
Yes.
Yes.
Yes. Mr. Gubler.
Yes.
Yes.
Dr. Painter.
Yes.
Mr. Lansbury.
Yes.
Mrs. Silverstein.
Yes.
Yes. Let us pause for a moment of silence to prepare for tonight's meeting. As we prepare, I would like to ask everyone to remember, regardless of our views, we are modeling behavior for our students around respectfully discussing opposing viewpoints. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Dr. Fox, do you have any agenda changes or additions?
I do not.
Can I have a motion to approve the agenda as presented tonight?
I'll make a motion that we approve the agenda as presented.
Second.
We have a motion by Mrs. Sullivan Smoot and a second by Mr. Painter to approve the agenda. Mr. Lansbury.
Yes.
Dr. Painter.
Yes.
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 Gordon. Yes. We have a special presentation from Dr. Switzer at Valley Health.
Good evening, everybody. Is it okay if I share my screen?
Yes.
Yes, give him
It's
just a
okay.
second.
Blake's getting it ready.
I'm still getting a disabled notice.
He's working on it, Dr. Switzer.
Okay. He must be down at the bottom out of my view.
Yes.
It's trapped in the snow and ice, but melting and then refreezing.
Aha, I think we're good. Now it's all operator dependent from here. All right. Let's see. All right. Well, once again, thank you all for the invitation. I am sorry that I'm a little bit limited on time this evening, but I am available until about 6 p.m. I think most of you probably know me, but just to make sure. So my name's Dave Switzer. I'm a family physician by background. I've been practicing in Page for 24 years now. And in addition to that role, for the last 4.5 years, I have been the medical director of population health for Valley Health System. So in March of 2020, as you might imagine, the job description for that role changed a fair bit to be significantly COVID oriented. So for the last 20 months or so, almost 2 years, I have been charged with the task of trying to keep up with COVID evidence, largely as it pertains to the community and outpatient setting. And so I was asked this evening to give you a brief presentation. I thought I would probably start with just a basic Omicron update, talk a little bit about masking, which is, I believe, the topic at hand, and what we are experiencing in the health system and in our community right now that might factor into that decision. I would add that as a family doctor, my general philosophy is I don't make decisions for patients. I provide them information in a way that is accessible and understandable so that they can make an informed decision. And for the most part, I see that as my role here this evening. I'm here to present this group information that will hopefully make it easier to make an informed decision around what you want to do for our school systems. I have a child that attends Page County Public Schools. I've had 2 children who have graduated from Page County Public Schools. I have a personal opinion. I'm not here to bring my personal opinion. I'm here to bring information. So with that, I thought I would start with, like I said, Omicron. So Omicron is the newest variant, or one of the newest variants of COVID. And one of the things that is thrown around, both in the medical literature as well as the lay press, is, well, it might be twice as contagious, but it's about half as dangerous. And roughly speaking, that is true. But here's the challenge with that, and hopefully this graphic will help illustrate this. So with the older variants, if 100 people, one person gives it to about 3 people on average, at least as the curve is climbing. So if you have 100 people that give it to 300 more people, and 4% of the people who get it are hospitalized, after that cycles through 4 times, you get about 8,100 cases and you get a little over 300 people in the hospital. If it's twice as contagious, but half as dangerous, so to speak, half as virulent, as we say in the medical business, if 100 people give it to 600 people, and that cycles through 4 times, that is well over 100,000 cases and well over 2,000 hospitalizations. So you can kind of picture how that can be a significant disease burden, both in the community and for the health system trying to take care of these folks. So this is, and I'm trying to get my orientation here. So this is Page County as of today, case reports. This was reported out earlier today. So as you can see, just to give you a little orientation, this was the peak that we had in the spring of 2020. This data, in my opinion, is not as reliable because we didn't really have good testing availability then. But as we moved through 2020, this was our peak around Christmas, New Year's, early 2021. This is the Delta peak that we experienced back around September-ish or so. And here to the far right of the screen is where we are now. So we are clearly at a level that is higher than any of our preceding peaks when it comes to case counts. I would like to talk myself into believing that there's a little plateau starting here. The caveat around that is, as some of you may know, there has been a lot more available home testing in the last few weeks. Our health system has been giving out home tests and folks have been accessing home tests elsewhere. And home test data does not get reported in this graph. That does not automatically go to the state like a lab from a health system laboratory would. So trying to be cautiously optimistic, but at any rate, we are seeing more COVID in our community case-wise than we ever have before. This is Valley Health System inpatient setting. And this data does include patients in the ER with COVID as well. But as you can see, similarly, on the right-hand side of the screen, we have more cases in Valley Health System over the last 2 weeks than we have ever had during the entire pandemic. We've had to put a lot of elective procedures on hold because of that. A lot of you are probably also aware that blood drives, blood donation is way down, and largely because of reluctance to have or to attend blood drives. And so we're experiencing a blood shortage. And last week, we had over 300 employees who were out with either documented COVID positivity or symptomatic. And remember, when they're in our facilities, they are wearing N95 respirators and eye protection and all of those things. So when our employee health does contact tracing, because we do our own internal contact tracing because we need to know the source of an employee infection, obviously the last thing we want to find out is that it was from inside our institution. 99+% of the time, roughly, we find that the employee was either exposed in their home or through some sort of other community contact. And as you might imagine, that's a very challenging thing to navigate when we have so much absenteeism because of illness. So switching gears a little bit and talking specifically then about masking. And we need to think about masking in two different contexts. So one context for masking is protecting a group of people. So in that context, when everyone wears a mask, and the term that we use in the healthcare setting is source control, because we know that a lot of COVID cases are pre-symptomatic or not symptomatic at all. There can be spread of COVID from folks who have no clue that they are contagious. So the way you mitigate that risk is everyone wearing a mask and spacing appropriately. If an individual wants to protect him or herself from COVID in the environment, then what they need to do is have a formally fitted respirator, meaning an N95 or something similar, that is actually tested to ensure that the size of the N95 is appropriate for their face structure. That's what we do in the healthcare setting, is we all get what we call fit tested once a year. They have to wear eye protection. And generally speaking, although this is not always accommodated in a healthcare setting, we try to do greater spacing. So to give you an idea, you guys might recognize this as a picture of an operating room, a place I definitely tried to avoid both as a patient and a doctor. But if the patient on the table in this operating room has COVID, all of these individuals have been exposed. Their surgical mask does not protect them. They're not wearing eye protection. The purpose of their masks is to protect the patient, to keep the patient from getting something from them. It is their masks do not protect them from the patient. So that's kind of the analogy that we need to have in mind as we think about a masking decision. So let's ask, besides masking, what other remaining mitigating factors are there regarding the spread of COVID and specifically Omicron? Well, vaccines help mitigate the spread. Currently, the Page County data that I most recently saw was that children aged 5 to 11, about 8% of them have received one dose of vaccine, at least one dose of vaccine, and about 30% of the adolescent population has received a vaccine. So obviously not a largely vaccinated student population as a general rule. Natural immunity. Folks who have had COVID previously probably do have some immunity. Now, having said that, the previous variants do not seem to be very protective of Omicron. Interestingly, the reverse seems to be true. It seems as though if someone has Omicron, they're probably immune to Delta also, but the reverse doesn't seem to be the case. And then, of course, I didn't include testing in here, but testing is sort of folded into the isolation and quarantine mitigation strategies. You can isolate people who are sick while you test them, and you can quarantine people who have been exposed to people who have tested positive. So I don't have a crystal ball, but if there is COVID in the environment that is very contagious, one potential, of course, is that there could be a large spread of cases and then massive quarantines related to exposures. So, and I'm trying to, be mindful of the objective of the audience here. Your objective is to educate our children, to educate the children in this community. And obviously, when there are a lot of exposures and a lot of quarantines and a lot of illness, it makes it difficult for you guys to staff your classrooms. I guess a secondary thing I would suspect is that if there are severe cases of COVID among your employees or their family members, there can be a significant health insurance cost associated with that as well. We've experienced that at Valley Health, being self-insured ourselves. And we have seen $1 million cases of COVID that were very complicated and prolonged. So maybe a secondary thing to consider. And then, of course, there's the broader community implication, because children have to attend school, and they could potentially bring COVID. They may not have a significant negative course themselves, but they could bring the illness to someone in their home who is elderly or immune compromised. And the classroom setting is a very unique setting. It's a place where, obviously, even with distance, people sit and move around for an hour to hours at a time. And if that is a source of spread that goes into the community, it can have implications, obviously, for businesses. It can have implications financially for the families whose parents may have to miss work because of that. So things to consider as far as the medical impact, so to speak, translating into a potential economic/financial impact. This is a look back at the Delta wave, more or less. This data is roughly from early September to early December of 2021. And as you guys probably know, death is the most lagging indicator of COVID. The cases come first, then the hospitalizations, and then the negative outcomes. So as you can see here, we were, as a community, hit pretty hard by Delta. In medical statistics terminology, we typically use the term deaths per 10,000 as our level of the statistical playing field, so to speak. So as you can see here, Loudoun County, to the north of us, had a death rate per 10,000 of about 0.5, and our rate was about 23 times higher than that. Interestingly, another way to look at that is we had 28 deaths as a county of roughly 25,000 people. Loudoun had 19 deaths as a county of roughly 380,000 people. So our community has had a terrible experience, understatement of the year, I'm sure, with this illness. I received a question just prior to the presentation, so this part is a little bit thrown together, but it has been in the news that the UK is relaxing their restrictions as far as these types of interventions. And so I was asked if I had any comments about that. Similarly, I want to give you information. So this is the information that I have seen that I am sharing with you. So one difference that in the UK as compared to Page County is they appear to have peaked. This looks on the right-hand side of the slide, appears to be their Omicron peak. They're on a rapid trajectory downward now. It appears there's maybe a little blip going on out here. I'm not sure what's gonna happen with that. But generally speaking, they are in a different place in this surge than Page County is. Just a reminder, this is where we are. Also, vaccination rate in the UK, about 90% of the population has had their first dose of the vaccine. And over 60% of the population has had a booster dose. Whereas this is the vaccination data in Page, once again, as I found when I most recently checked. So we have just over 50% of our population with at least one dose. And I mentioned some of the pediatric statistics earlier. So I guess my comment about the UK data would be that they're in a different place in this surge. I'm not going to say one way or the other how the experts in the UK use that information to make their decision, but it is different data for sure, at least in my opinion. So In summary, I guess what I would say is, and I know that there have been school systems close by that have announced their intention to make masking a choice. I would just encourage this group, if I can, to look at the data as it pertains to us and make an informed decision based on that data and our current clinical situation as a community. And I guess the summary points I would make in terms of things to consider, speaking to this group, being mindful of you as an audience, if you have a rapid, significant transmission within the schools, it certainly could impact your execution of what your objectives are, which is to educate our children. I would add that I am pretty confident, based on my understanding of the data and my medical experience, that a decision one way or the other as far as masking choice will have implications for your healthcare providers and your resources in the community. If a huge wave of COVID spreads through the community, or if we haven't found our peak yet and we continue to climb, we are going to be very strained as a healthcare system delivering all types of healthcare, not just care for COVID patients. And I would add that this is timing dependent in terms of the implications. Kind of thinking back to that, I won't flip back, but thinking back to that UK slide, when transmission rates are lower, the implications of a masking choice are different. And so there could be, I don't want to speak for the board, obviously, but there could be a timing discussion that could be had that would have medical significance, for sure. And then, as I mentioned, I think the decision will probably be felt in some way, one way or the other, throughout our communities, families, and the economy, just based on the epidemiology as I know it. So with that, I very much thank you for your time and attention. I'm honored that you invited me to speak to your group. And I do have a little bit of time if there are any questions.
Dr. Switzer, thank you very much. I thought the information you presented is very helpful for when we're thinking about our decision. Does anybody have any questions?
I got a couple. Dr. Switzer, so a UK graph I saw, and I think you're right. It's on the downturn, but they're making that decision with almost at that point where it's at currently is it's twice as many, or it's significantly higher than what they've had COVID levels all the way through the pandemic. So they must have confidence of something that it's going to continue to go down even below, or maybe they have confidence that the Omicron is a less lethal variant.
I think I can't speak for the experts in the UK. I can only give you my takeaway from that as far as what could be behind that decision. When you have a population that is approaching 90% first dose vaccinated, the likelihood of morbidity is much lower.
Yeah, I agree with that. On the other thing, the blood shortage, I don't know if you knew, but we had like 30 people sign up for the blood drive here locally, and they didn't have people to staff it. So they had to cancel it. That's just something for you to know.
Sure.
And I think
it was Red Cross.
Yeah, Red Cross, because 30 of us signed up, and they had to cancel it. Could you help me with the vaccine, understanding that better? Because in our quarantine, and y'all correct me if I'm wrong, the vaccination, they can come back almost immediately, right?
With the new CDC.
The new CDC. And to me, that's counterintuitive. And if you could just help me understand that better, because I've always felt once we found the vaccines were having breakthroughs, why are we making a special case for someone to come back earlier if they have been positive with a vaccine, because they can still spread it?
So actually, and feel free to, if I lose you, maybe go back and clarify. So this is my recollection of the sequence of events as far as the CDC recommendations. They actually got a little more restrictive recently with respect to vaccinated but not boosted folks. So in other words, if you are vaccinated and boosted and you have an exposure, not the illness, but you have an exposure, if you rigorously wear your mask, you can continue your usual activities. You need to isolate when you become ill. If you are vaccinated but are overdue for your booster, then your restrictions are very similar to the unvaccinated population. And so the expectation is that you would quarantine for 5 days, ideally get tested at 5 days if you can. If you are asymptomatic, then you can go back to your usual routine for the next 5 days with your rigorous masking. But that's the recommendation for the unvaccinated population too.
Okay. And I don't think that's part of our mitigation, right?
Not right now.
Not right now.
Eventually it will be, yes.
Okay. All right, good. Thank you.
Sure.
Are there any other questions? Thank you, Dr. Switzer, for your time.
Thank you.
Thank you, guys. And I do want to say thank you for your service to the children of our community. Is very much appreciated.
We're going to move on to 4.01, citizen comment. I'm going to read the statement, and then if you'll excuse me after I read it, I'm going to go out and read it to our guests in the hallway. The Page County School Board welcomes citizen comment during regular meetings. School board members do not respond to public comment during a meeting. All comments should address a matter related to Page County Public Schools. The school board will not hear public comment that involves an individual student-related matter, the disclosure of which would violate applicable confidentiality requirements. The school board expects that each speaker will be courteous, modeling for our students how one can respectfully agree or disagree with others' views. Speakers will address their comments to the entire school board and not to one individual board member, nor to the superintendent, a staff member, or the audience. Speakers will have 3 minutes to present their comments from the podium. All school board members did receive the written comments that came in today.
Just start speaking.
I think you need to state your name and address.
Please state your name and address.
Hi, good evening. My name is Kelly Switzer, and I live at 7 Johnson Drive in Luray, Virginia. Thank you for your service to our community and for hearing the thoughts and concerns of the community tonight. My youngest son is a junior at Luray High School. All three of my children completed their educations or will at Page County Public Schools, and my two sons are now in college and succeeding in part because of the great education they received here at Page County High Schools. Last week, Page County had an all-time record COVID cases, and our positivity rate is 42%. And posted on the Page County Public Schools Facebook page an hour ago was a list of more than 24 alerts about COVID exposures in our schools. Come on, why is this even a discussion tonight? We are all weary. We are anxious for normalcy. We are longing for the freedoms of yesteryear. And we are all so tired of masks. But if you told me that at the end of this, my mask wasn't effective and it didn't do anything, then what's the worst that happens? We all laugh about how silly we looked and have a real new understanding of the scent of our own breath. Okay, sure. But on the flip side, if my mask or my son's mask prevented the inadvertent yet unnecessary suffering, pain, and possible death of one of my neighbors, then I would wear my mask every day for the rest of my life. Because for me and my family, we could not live with ourselves if we could have prevented just one death. In the fall of 2020, I put an American flag in my yard for each Page County citizen who passed from the coronavirus. Our project was featured on WHSV, and many local families joined in the effort. What started with one flag has now become a garden of flags. And each of those flags represents someone in our community who is no longer here with us. And that's what this boils down to. Those among us who refuse to believe that the selfish desires of one are more important than the good of everyone. And I thought about coming here and telling you about how a larger epidemic breakout would strain our community, our hospitals, our families, our education system, our sports teams, and our local businesses. The economic impacts of this pandemic are immense. I'm a small business owner in this community. I understand the consequences, and my family has had to make some very tough financial decisions. I hope you too can make some hard choices and think creatively to come up with some solutions. I provided Dr. Fox with some information from Harrisonburg City Public Schools on how they are investigating a phased approach to mask removal. We've already been wearing these masks for over 2 years. What's another 4 weeks of seeing where our infection rates are? What is the problem with waiting 4 weeks and seeing what our vaccination rate is? Can't we phase this in and evaluate based on data and metrics instead of emotion and politics? No matter what you decide. What?
That's your 3 minutes.
Oh, okay. My son's going to keep wearing his mask.
Thank you. Thank you.
Take care.
Yeah. Who is it? Oh.
You guys have my name, or do they give that
Please
to you?
state your name and
Okay, yep. It's Bobby Alston. I live. Oh. I live in Chattanooga, Virginia. It's 280 Town Road. It's my address. I'm a lifelong Page County resident. Got 2 kids currently enrolled. One's in Page County High School, and I have a daughter in Trinity Elementary. And I'm surprised. I didn't want to be here. I didn't think we'd have to be here with the governor's executive order. I mean, it's pretty clearly stated that parents have the option to waive the written. I understand there's a view of doing what's best for the community versus individual rights, but this community, Page County, overwhelmingly supported Governor Youngkin by like 78%. I mean, his executive order is pretty clear that parents should be given a choice from the kids wearing masks. And for almost 2 years, we followed the previous governor's orders reluctantly. Well, we did it. So, you know, for 2 years, my daughter's been playing at the store here, the rash around the face, the headaches, and it's preface that the teachers do a great job. They don't get enough credit. They deserve a raise. Definitely support our teachers. But there's a handful that have taken the COVID and the mask wearing. You know, they prioritize that over educating. You know, for example, you take your that to the restroom. There's someone in each end of the hallway making sure when they go to the restroom they don't pull the mask down. We've got, you know, teachers yelling across the hallway, "I see your nose, pull your mask up." You know, kids in the hallway. So, or, you know, my one in Shenandoah, I think the primary teacher was out, ill, and she's in the class, and she was told, "That's enough drinks for today. Quit pulling your mask down." So, I mean, there's a lot of effects of the masking. You know, I just, you know, overall, I think we've seen with the recent case and the spikes in the case, we're probably at the highest transmission rate we've had in Page County, so the mask clearly not working. And again, that's all I have.
Please state your name and address.
All right, Amelia King, 7 Deerfield Drive, Luray. First, I want to say that I typically come to these meetings with a written statement. I like to sound educated, and when I go off the cuff, I get really passionate. And I'm not always able to say exactly what I want to say in the appropriate way. The last time I was here, I did come with a prepared statement, and I did go over my 3 minutes. There were several people here, Breeden and Painter, who had a fit, cut the microphone off, and what the general public doesn't know is that sweet Mr. Cave came up and keyed the microphone, requesting backup for arrest because I continued to speak past my time allotment. Working in the dental field, if somebody has a problem, I don't just cut them off at 15 minutes and say, "Oh, I'm sorry, we didn't get that problem addressed, but if you make another appointment, we'll see you again in a couple weeks." Okay? So I think what I've asked for before is transparency. I'm not sure why it is that you can't give me the time with a prepared statement, so I'm not rambling on and wasting your time. But I decided to come without that prepared statement today. Interestingly enough, we went along with the last governor's mandate. The executive order seemed to be awesome, just applauded by everyone here on the board, and that is the path that we took. Obviously, people got riled up because Northam did, pardon? Oh, okay. Because Northam refused to acknowledge parents' rights. Hello. And maybe something to do with the Loudoun County rape that was covered up because they were concerned, they were not concerned about boys using the girls' bathroom. However, I still fight for transparency. I still think that you need to honor the wishes of parents. And as I emailed on Tuesday, we need to think as a collective county. We don't need to worry about what Richmond has to say. And there's a lot of science. There's a lot of good science. You know, the mask protects the person that's wearing it.
That's 3 minutes.
All right, no mask mandates. My children will not come to school on Monday with a mask on. All right, that's not happening. And I will bring every single gun loaded and ready to, I will call every.
That's 3 minutes. You've gone past your time. It's a policy. Thank you.
I'll see y'all on Monday.
Shit. I think it's Hello, please state your name and address.
Aaron Weekly, 430 Kibler Hill Road, Lee, Virginia. Thank you for the opportunity to speak this evening. First of all, I did hear Dr. Switzer's comments. Just a couple responses. What I took from that was masks don't prevent the spread in his operating room analogy that he gave. I didn't hear anything about the risks of children wearing masks. And I also didn't hear that the vaccine does not keep you from getting or spreading the disease. But that we're not here to debate the medical nature of COVID or how bad it is. Really what we're here for is the authority of the executive order, and as a board, do you have the autonomy to go against that? And so I wrote a letter that many of you have probably already have seen. If not, one of the things listed in Dr. Fox's letter was SB 1303 as possible direction to continue masking. There was a press release from the senator that authored that, who, by the way, is a practicing physician. And she said, and I quote, SB 1303 has been used against our children and against its intent this school year to advance an agenda. SB 1303 does not mandate the use of masks in school because the CDC does not mandate masks. Governor Glenn Youngkin's executive order does not ban masks. It gives parents options. Just like SB 1303 does not mandate masks, it gives school boards a roadmap to keep schools open. Today, we know the risk of hospitalization for children is almost none. In fact, of Virginia's estimated 1.9 million children, 0.07% have been hospitalized with COVID-19 since March 2020. At the same time, the use of masks in school presents risk of learning loss, social, emotional challenges, and other issues. Parents, constitutionally and logically, are the best people to do an analysis of what's best for their child. So I would say if the school board is willing to go against the constitutional authority that has been granted by the governor to issue an executive order that has the same power of law, then by that same premise, as parents, we also should expect to not follow the policy set forth by the school board in enforcing masking, and reasonably expect no recourse of action for our children or for us as parents. You're setting a dangerous premise if you go against this order. And then lastly, I would say 79% of Page County residents voted for Glenn Youngkin. His platform was embraced by voters, and front and center of that platform was to give parents the autonomy, to give parents more control in what their children are taught and how policies are enacted in the school board or in the school system. And I think those same voters put all of you in office, so it's pretty clear, I believe, in how your constituents would want you to vote. Thanks for your time. Appreciate it. Hope everybody has a great evening.
Thank you. On to 5.01, information, health and mitigation strategies. Dr. Fox?
Yes, thank you, School Board. I appreciate the opportunity tonight to share information with you as it relates to the governor's executive order and our health mitigation strategies that we currently have in place. I also want to take a moment to thank the board for requesting various pieces of information, for asking multiple questions. and for requesting feedback from our parents and staff as we move through this process. I'm going to move very, very quickly through the first couple of slides because a lot of this Dr. Switzer already gave to you, and you saw much of this last Thursday at our meeting, but I just wanted to put it in perspective of a week later where we are with our different health data, because that's what we've been presenting to you at each of the board meetings. He talked about the Omicron variant and how it's more contagious. We are seeing those case rates accelerating across the state. We do see models that predict a sharp rise in cases for several more weeks. And the disease does appear to be milder for those who are vaccinated, but more serious or deadly for those who are not vaccinated. And the VDH and the CDC continue to recommend getting vaccinated as your best defense. Our daily case rates, you can see as of January the 24th, we did hit a spike and we've started to come down, and then we hit another little spike. So you're seeing sort of a decrease with a little up and down in the case rates across the state of Virginia. In terms of our core indicators that we've been using since August to determine our community transmission rate, you'll see that the total number of cases per 100,000 on the 15th of January, it's now sitting at 1,195, and that puts us at the high level. You'll see that the percentage of positive PCR tests, same date for January 15th, we're sitting at 42.2%, which also puts us at the high level. And we have remained in the high range since September in both of those areas. So that puts us, those two indicators together, determine our level of community transmission. So we are still sitting at the high range for community transmission level. The next is a updated COVID dashboard as of today. And I think what's interesting to note for you all, because the impact that everyone was talking about, we're seeing it in our schools. We're definitely seeing it in our schools, not only with students, but with our staff. If you look at the number of active cases, last week when I presented this information to you all, we had 49 ongoing active cases. We currently have 77 cases. So just within a week, we've increased about 30 cases, 32 cases. I also included on this slide for you something new. We talked about this with those three pieces about our level of transmission within a school. I just wanted you all and I wanted our public to be keenly aware of our staffing capacity levels, because we are reaching critical levels in some of these areas. You'll see that Luray Elementary, Page County High School, and our nutritional services are all at high. And we are tomorrow on Friday of a snow week, we're going to slide into home plate barely with some of these staff shortages being covered at those three locations. So I do want to take a moment to thank our principals and our staff, our teachers, our nutritional services staff for finding ways to be creative to cover those positions. But I just want to, again, make sure we're keenly aware that right now staffing is at a critical place. We've got two schools and another department that are in the medium or low medium, and we put low medium there because they're on the verge of becoming medium. And then you've got several that are in the low category. So we just wanted to share that information tonight. Just again, our goal is very similar to what Dr. Switzer said. I'm just presenting you with information and facts, and then we move forward with our decision making. Our current PCPS mitigation strategies that we have in place, we've talked about these all year. We currently do have universal masking in place. We are trying to physical distance as much as possible within the buildings, knowing that there are some constraints to that. We do encourage hand washing and respiratory etiquette. We are cleaning and sanitizing facilities as best we can. And please, I need the public to also understand that COVID has hit our custodial staff as well. So we've been short some custodial, and we've had, in one case, we've had some students help out, and in other cases, we've had staff that just pick up and help out at the schools. We are encouraging students and staff to stay home when sick, and that is an appeal that we're going to continue to make. That is one of the bigger pieces of this, is please stay home if you're sick. It may not even be COVID. It could be some of the other things that we're seeing circulating. but we just ask you to stay home when you're sick. We are continuing to do contact tracing with our isolation and quarantine guidelines. We are looking at ventilation upgrades in a variety of different ways. We are still involved in the VISTA testing program. We're investigating the Test to Stay program. And we did get a shipment of home tests. Those have all been distributed. I think we only have a couple more in the division. We have requested 500 more, and we are awaiting those. Those have been very helpful to families who couldn't access testing in other places around the community because it was, there were just too many people. So we will notify everybody when we get those other home test kits in. And we are promoting vaccines as are recommended by the VDH and the CDC. With respect to our quarantine practices, we have made the decision as a division to maintain more stringent quarantining practices. And the reason we did that was because of all the data you just saw in terms of our staffing capacity, our transmission rates, our outbreaks that we're seeing at schools. Right now, we currently have 4 outbreaks taking place, and we haven't been in school for a week. So it's just impacting us, even though we haven't been in school. We made that decision for those to be temporary. They're not intended to last. We believe in moving forward with the CDC's recommendations, but we just want to do it in a manner that we think is the safest for our students and our staff. We did do that, made that decision in consultation with the Lord Fairfax Health Department. We talked through it with them. And I do want to make it clear to everybody that the VDH does give us discretion to do that. We can be more stringent if we need to be and choose to be with those quarantine guidelines. And I also want to stress that it's temporary. That's not a permanent thing. Once I think things settle down a bit, we'll move, or we might even see that we have some blend of the two together. Our most common practice is the 10-day quarantine period with an option to return on day 8 after testing on days 5, 6, or 7. It does require a negative PCR test or an antigen test. You have to be symptom-free, or your symptoms have to be improved, and you have to be fever-free for 24 hours. I do also want to point out, because this is important for us to know, that if masking is optional or parent choice, some students will lose the VDH K-12 close contact exemption. And that exemption is if a student is sitting next to another student who is positive, if that student has a mask on, they are then excluded from being considered close contact, so they wouldn't have to quarantine. The student who's positive would have to quarantine, but the one sitting next to them, if both of them are masked, would no longer have to quarantine. So just a piece of fact, a piece of information to keep in mind as we move forward. So we want to share with you some of the various considerations that are on your plate and pieces of relevant information. The current CDC recommendation for masking is that universal masking is in place for all teachers, staff, and students and visitors at K-12 schools, regardless of vaccination status. And that was updated last August for us. The CDC now does also recommend the use of KN95 masks or N95 masks rather than cloth masks because of the high transmissibility of the Omicron variant. In terms of some of the legal considerations that are before you, the first of which is your constitutional right as a board, which comes from Article 8, Section 7, and it provides that the supervision of schools in each school division shall be vested in the school board. And what that basically means is that you have local choice, but that local choice needs to be consistent with state law. Another legal consideration, which has been mentioned a couple of times tonight and is definitely in the press, is that Senate Bill 1303. It was passed by the General Assembly in April of 2021 and enacted as law. It does expire this coming August of 2022. It can be repealed by the General Assembly before its expiration date, and my understanding is that there are some movements underway to potentially repeal that. It does require that schools do two main things, and that is school boards must offer in-person instruction to each student this school year. And so that answers the question when people ask us, why as a division do we just not all go virtual? Like last year after the holiday break, most schools in the state went virtual for 2 weeks or a week or a period of time. This law doesn't give us that flexibility. We can move a school to remote learning, but it has to be a case-by-case situation. And then the second provision is that one that's sort of the one that's contentious right now in terms of what was meant in terms of Senator Donovan, who proposed it, and then it went through legislation, and there was actually the second piece was added in at the House level. But the school board must provide such in-person instruction in a manner in which it adheres to the maximum extent practicable to any current application of mitigation strategies provided by the Federal Centers of Disease Control. So that's why this is the critical piece and why everybody's talking about it. It's because the CDC's current recommendation is universal masking for K-12. So that's law following the CDC. The interpretation of that is what's out there, and there are some different versions of the interpretation of that. Another legal consideration for you is the State Health Commissioner's order that was issued last August, and that's the one that forced us at that point to move to universal masking. And actually, if you all recall, it was on the day that we were scheduled to meet as a board and do this very thing, talk through it and decide whether we were going to require masking or whether we were going to allow parent choice. That issue required everyone to wear a mask in K-12 public and private schools, and that includes students, staff, and visitors. Two clarifications about that. The requirement for school divisions in August, it was not an executive order by the governor. This was a health order by the state commissioner. And I just want to clarify that because that's an important distinction between what we're going to talk about next with the current executive order. Governor Youngkin's executive order that he issued on January 15th, it directs the state health commissioner to terminate that health order from August 2021. So that health order now is essentially off the plate as it's been terminated through the current executive order. Does that make sense? Then we have Governor Youngkin's executive order number 02. We'll refer to it moving forward as EO number 2. That was issued this past Saturday. It does go into effect this coming Monday, January 24th. It contains 6 different directives to school boards and to the Department of Education. One is to terminate that health order that we just talked about. One is that parents may elect for their child not to be subjected to any mask mandate in effect at any school or educational program. The parent electing that mask mandate shall not have to supply any required information providing a reason or a consideration for why they've made that choice. They should not be required to wear a mask under any policy implemented by a school division or a particular school. And the superintendent of public instruction is required to rescind the interim guidance for COVID-19 prevention in Virginia pre-K-12 schools that was issued back in August and updated in October. They are ordered to issue new guidance. And then school divisions should marshal resources to improve indoor air quality in school facilities. And just as a side note, some of the things we're looking at are individual air purifiers in classrooms. We are doing the HVAC work currently under our ESSER 3 grant funding, that $4 million that we're investing in those systems that will improve conditions and circulation and ventilation. We are investing in some N95 masks. And we're talking about potentially increasing those health checks that we do every day. Rather than just a parent checking a form, we might actually do some temperature screenings and things like that in the schools. That's a logistical issue that we have to work through with our principals, and it requires staff to be present to be able to do that. So we'll have to just work through how and what we want to do in terms of upping our health checks. An executive order is not statutory law by definition, but it does have the force of law. And an executive order can be overridden by the legislator or a court if it's deemed to have exceeded executive authority. And that's just part of our checks and balances that we have in our Constitution. Executive order number 2 applies to students and visitors to schools. It does not apply to staff members. And executive order number 2 does not ban masks from schools. Rather, it gives parents choice in the matter. So any questions there before I move on? Okay. Just to clarify a couple of other pieces that have come up, the Department of Labor and Interior has a set of standards in Virginia that currently require all employers to require their employees to wear masks while they're at work. That then is a requirement for us because we fall under the Virginia Department of Labor and Interior. Our staff still have to wear masks. So even if we approve for parent choice tonight based on the executive order, we need our staff to understand that that isn't applicable to them as of right now today. Governor Youngkin has requested that the Virginia Department of Labor and Interior that they review their standards with respect to his executive order, number 2, and that they provide him a report within 30 days. So it is possible that there might be a change to those DOLE standards in the next month, but that will not happen by Monday. The other piece that isn't impacted by the governor's executive order is that masks are still going to be required on division buses and cars, regardless of whether staff and students and parents have choice. And that's because that is a CDC federal mandate. And that just requires that masks be worn on all forms of public transportation. So that includes all of our buses and all of our division vehicles. It includes students and staff. And again, the executive order does not remove this provision as it's a federal provision. We're currently waiting on guidance from the Virginia Department of Health in response to Governor Youngkin's executive order. They are reviewing their guidance to schools, and they have shared that that guidance will be given to us. They just don't know when. They anticipate quickly, but I don't know that it'll be before Monday for us to have as a piece of our decision making. The Virginia Department of Education, with the new governor comes the transition there in leadership for the superintendent of public instruction. Currently, there is an interim. Rosa Adkins is there. She replaced Dr. James Lane, who left in December. She will be replaced. Ms. Adkins will be replaced by Jillian Below, who has been named by Governor Youngkin as the next superintendent of public instruction. And school divisions are waiting on information from VDOE about executive order number 2. We anticipate that that guidance will likely be as it was in the fall, which was to consult with your legal counsel. But we'll share with you when we get that information. We'll share that with you should Ms. Below share something different with us. I don't know the timeline of that transition, but we'll keep an eye on it. So that then presents for you all the legal dilemma, because right now there's a conflict between Senate Bill 1303, a conflict between your rights that have been given to you through the Virginia Constitution in Article 8, and Governor Youngkin's executive order number 2. The other piece to consider legally is it's a given that there will be some litigation around this. It's already started. Currently, there are parents in Chesapeake who have filed a lawsuit this week asking the Virginia Supreme Court to block executive order number 2. And there is the potential, as was shared with us and many other divisions, that we could potentially face lawsuits from both sides of this. If you make it optional, people will sue that we are potentially risking their children's health, and vice versa. If we don't make it optional, parents will sue that we're in violation of the executive order. So that's your legal dilemma information. Any questions there? Okay. You're welcome. So parent and staff feedback, just wanted to give you an update on that. We did, on Tuesday, we pushed out that notification to parents and staff, and we included an opportunity for them to provide us with feedback, both in a selection of a choice and in written comments if they wished. We do intend to gather feedback from students, and we had hoped to have them in school to be able to do that this week, but Mother Nature took care of that for us. So we will make a decision about that depending on where things go tonight. We'd still like to hear from the kids, so it's likely we'll still push that survey out. We will only do it for grades 6 through 12, though, and it will require parents to be made aware, because parents do have the option for their children not to participate in surveys. This particular survey would not be mandatory. It would be optional, voluntary for any student who wanted to participate. In terms of the data that we have as of, 3:30 this afternoon, for our parents, there were 403 parents who responded. Of those 403, 71% of them are in favor of parent choice. and 29% of them are in favor of universal masking. With respect to staff, we had 204 submissions. 36% of them are in favor of parent choice, and 64% are in favor of universal masking. Those surveys remain open, and we'll likely keep them open until we determine that we're ready to move forward, and then we can turn them off.
These results aren't related to the one with the staff with PCEA, right?
No,
It's
separate.
totally separate.
Yep.
Which those numbers are close, but it's closer to being 50%, it seemed like, with what I read.
Yeah, and remember, the PCEA only surveyed, my understanding, is their membership.
Their membership.
Yes.
Teachers.
Yeah. Yeah. No, this is separate. This is our survey that we pushed out, or feedback that we pushed out from the division level. All right, so moving forward, where does that leave us? What are some options? And by no means are these the end-all to be-all options. As I've done for you in the past, I'm just providing you with some potential things that have been shared or that other divisions might be doing. A parent mentioned tonight the Harrisonburg situation, and that's an option for you. I appreciate her sharing that information, as I do the parent sharing the information about Senator Donovan. So option number one would be that you can move forward with the executive order number 2 as it's written and make masking a choice for parents. Just a couple pieces of information there that would need to happen. Masking would remain in place for all staff right now because of the DOLE standard. Masking would still be required on buses and division vehicles because of that federal mandate. And masking would be required regardless of parent choice when students come back from the quarantine. Once we move into the CDC's new 5 days, you're out, but then you wear a mask for the next 5 days. We would request that parents would honor that based on those guidelines, whether their parent choice is for their student not to wear a mask in school, but they would for that period of time for that quarantine. And then we would require parents to sign an opt-out form notifying us that they're choosing for their child not to wear a mask to school. The second option would be that you move forward with executive order number 2, say in 1 month. Let things settle a little bit in terms of our case rates and transmission rates with respect to Omicron. And all of those bullets from number 1 would still apply because you're in a sense then approving to give parent choice. You're just delaying it until perhaps the numbers settle down a little bit and we don't see so much transmission. Number 3 would be you could continue with the universal masking as we've been doing all year. So nothing would change. We continue to require students and staff to be masked while in school. Option number 4 would be potentially you could direct the division staff to develop a database system to provide parent choice for masking once we reach a better place with community and school transmission rate. And I'd ask you, Ms. Wallace, if you could slip to the next slide for me, please. This is what the parent referenced earlier tonight. This is from the American Academy of Pediatrics. And this is a model that Harrisonburg Schools is looking at potentially, where you sort of set some thresholds and you make a decision. If we reach a certain rate with cases or testing, we can decide what our metric is, and then that then sets off what you do with masking. It might be that because the rates go high, you do masking for 4 weeks, and then you revisit it and you move to your parent choice. And we could look at, this is just one version of it, we could look at a version of this where we set our thresholds and decide where we want our variables to be. To me, we would engage, I think, with some healthcare professionals to help us, or the health department, to look at where those thresholds might be. Because as I shared with you earlier, we've been in the high range since August. So using high, we may never get out of high for the next. But if we are at 1,000 now and we were at, say 12, there's a difference there that we might feel more comfortable for some people to remove a mask mandate and allow it to be choice at that point. So that's an option, and then certainly any other suggested options that might be put on the table. Those are just 4 potential places for you to go that we wanted to share with you tonight. And then just in summary, we are certainly grateful to everyone for the feedback that we've received not only from our parents, but from our staff. We want them to know that we appreciate them taking the time to provide us with that feedback. And regardless of the decision that's made tonight, there are going to be people that don't agree. That's just the fact. What I would ask as a superintendent, and what I ask for our staff and for our students and our families, is that we simply work together moving forward. And that the only way we're going to move forward is if we do that together and not apart. And I asked this back when the mask mandate came out when we started school. Please don't take your frustrations out on our poor administrators, our teachers, and our staff. They're just doing what they're told to do. We're sitting here tonight, the decision-making lies here, and how we move forward lies here, not with them. So please don't get angry with them. They aren't the ones making the decisions. They're just trying to do what we ask them to do. As with everything related with COVID, things are constantly changing, and that's just a reminder. What we're sitting here talking about tonight, we could all wake up tomorrow morning and there be something that changes every piece of a conversation. And unfortunately, we've all had to get used to that, and I don't think that that's going away. And I ask again that everybody continues to be patient and show flexibility, even though we're all tired and there's a lot of fatigue on being patient and being flexible and showing grace. We just have to continue in that vein. Our ultimate goal as a school division is to protect the health and safety of every single staff member, every single student, their families, our community, and to keep schools open for in-person learning because we know that's what kids need. I will just tell you right now, both of those things are a challenge for us because of the Omicron variant. People want transparency. I'm being transparent with you. Right now, there's a challenge in both of those areas for us. And we're going to continue to just communicate information as we receive it. As we get it, we'll push it out. Whether it's to staff or to families, we'll make sure that we continue to communicate with everybody in a timely manner. So thank you again for the opportunity to share information with you, and certainly will answer any questions that you all may have this evening.
I think one of the parents mentioned that her child was in the classroom, that someone was a positive case, but they weren't in direct within 3 to 6 feet. And they didn't know anything about it. Did we notify?
That's what all those letters are, but because of confidentiality, we can't specifically say, Dr. Fox, you exposed Rolf or Mr. Gubler.
But you can't say it was in this classroom?
Did you do it like the lice letters?
Yeah, well, and if that student is considered to be in close contact, the school's calling because they're likely going to be
But this student wasn't.
quarantined.
This student wasn't, but the student ended up getting COVID.
Well, let
So
me,
the parent would want to, if I was a parent
yeah,
and my child was close by, it doesn't mean I got it from that source.
yeah. No, we
Could
should
have got
be
it someplace else,
notifying.
but I would want to get my child tested.
Yeah.
After day 4,
Yeah.
5.
Yeah.
Just to
And
make sure.
we've had situations even where we've had a large group of kids that weren't considered in close contact with somebody who was positive, but they were around. We've notified families just to be careful, to let them know they were potentially in the vicinity, but they weren't considered close contact, to monitor and watch for symptoms, just so that they had an idea that
I
they were
think that's what this
potentially.
parent was getting at, was that exact.
Yeah.
So we are doing that.
We are
Maybe
doing
just
that.
missed it there.
Yeah, I'll tell you, and I'm not going to make excuses for anybody. Everyone's trying to do their best with contact tracing. It is a huge ordeal. It's consuming all of their time. We're not going to get it right every time, but what we do is try to fix it when we make a mistake.
And parents should feel willing or feel okay to go and tell somebody that, hey, my child did end up getting it and they were,
Absolutely.
I wish you'd have told
Yeah.
me, right? So we know,
Yeah,
right?
yeah, absolutely. Absolutely.
Thank you for presenting.
Sure, you're welcome. Any other questions? Thank you all.
So our next agenda item is .01, approval of COVID health mitigation strategies.
Which one?
Yeah, which one? 4,
So
1
we
through.
would need a motion. We need at least a motion and a second to be able to discuss. We would need a motion for one of them.
Now, I just want to ask a clarification. If we don't have a motion here,
Then nothing happens.
Then
and
And
they
nothing
go
happens.
haywire
Then
one
you,
day.
then you follow the EO. Right?
I was under the impression if we did not make a decision.
It stays as
we
is.
stayed as we were doing. That's what we were told last.
Okay, I'll go. I make a motion that we move forward with executive order number 2 and make masking the choice of the parent.
I'll second that.
We have a motion from Dr. Painter and a second from Mr. Painter to move forward with EO2. So do we have any discussion?
I would just like to make a comment if that's allowed. I would just like to say, for those listening and anyone else, that if you think for a second that we take any of this lightly as a board, you are 100% wrong. We tried to look at every piece of information, and we all know there's lots out there, and it could change within 5 minutes, and we saw that happen a year ago. We saw that happen with 3 different times in one day. And it is so frustrating because we base our decisions on what we have. And the other thing I would like to say is, parents, you have a responsibility in this decision. In that, as we go forward, whatever the outcome, the ball is in your court when it comes to your child coming to school if they're sick. You know your children well enough, or you should, that if your child isn't feeling well and you can look in their eyes, you know your child, you know what's real or not. If we go this route, don't send your child to school if they're not well. Now, I've been told, well,
It's allergies.
they'll tell me that they don't feel good. Okay, keep them home. Put them in their room. Don't let them have TV or a phone or iPad or computer or whatever. If they're sick, they should be laying down and resting, taking it easy. If it's real, the symptoms are going to come. If it's not, I bet they won't ask that too many times if that's the practice that's going to happen. But parents, you have a role in this as well on the home front. And we already know for decades, before COVID ever came into play, children were coming to school with fevers, throwing up the whole 9 yards. And there they were in the classroom. And now every child in that classroom's exposed. It's the same scenario here. You have to do your part. Let's make this thing work. Let's make this thing work as a team. Let's put Page County on the map. The parents are doing their job. They're not sending their kids to school ill. And if they are ill, they're keeping them home, getting them checked out the whole 9 yards. You've got a part in this too. And if we work together, then who's to say the quality education of our children and our school system will be one of the best ones ever? But we need your support. The ball's in your court. You're making the choice. I'll abide by that. But you have to do your job in making sure that your child is okay to come. And that's with any phase, whether it's a school activity, a ball game, whatever the case. The ball's in your court. Your kid comes to school sick, shame on you. Again, I want to work together as a team. I want success for our kids. They deserve that success. But daggone it, parents, get on board with us. Be our team. Cheer us on, and we'll support you as well. But it's time you kick in 100%. I'm done.
Thank you. I have a comment. or question. Dr. Fox recently said, our ultimate goals at PCPS are to protect the health and safety of every single student and staff member and to keep schools open for in-person learning. She also went on to say, both of these are a challenge right now due to the contagious nature of the Omicron variant. That means we're going to see, if we go forward with this measure, we still have to vote on it. If we go forward with this measure, there will be more and longer quarantine periods for kids. There will be more school closures, and sports programs will be periodically shut down. That's a fact, at least in the short term. I'm finished for now.
So I've never heard Mrs. Sullivan Smoot so passionate.
Yeah.
But she's correct. The best mitigation strategy is not exposing other people if you have it. Quarantining is huge. That's why I'm big on this vaccination. We need to change that rule. You know, if somebody gets it, you should be out till you have a positive test or a negative test that says I'm back. That's my big thing. And I'll just tell you, from my personal opinion, or my personal view of things, I had COVID in September. I got the Delta, I assume. And my quarantine was up on a Monday. I didn't go out, and I went nowhere until that following Friday just to make it extra couple days so nobody would ever get it from. And that's the attitude we got to have. If you're sick, you don't want to give it. I don't want flu A, B, C, strep. I don't want any of that, right? Neither do our teachers. Now, with that said, the N95 mask, what's the update for staff? We're going to buy those for staff, correct?
Yeah, we have purchased some. We ordered another batch today. As I shared with you all, they're hard to get, but we are getting them. There are lots of them out there that are not original or good quality, and they're a little bit more expensive, but we will use ESSER 3 and ESSER 2 funding. What we'll have to do is we need to set up a process for teachers to get them, because what we won't do is just leave a box of them sitting out. We'll ask staff members. We're not going to make it hard for them in any way. We're not going to make it embarrassing or anything like that. We just want to keep control of them a little bit more than we typically do with our disposable masks. But we'll make them available to any staff member that would like to request them.
Now, are they washable?
These are not. These are disposable.
Okay.
They are, the difference between the KN95, as we've been told, we talked with some medical professionals about it, and it was referenced tonight by Dr. Switzer. The N95s have to be fitted, actually professionally fitted by a person in the healthcare industry, and they are designed to be reused. These don't have to be fitted, but they do provide a much tighter seal, whereas, some of these masks have gaps, these don't. But they are not reusable. So that's why we'll distribute them. So if staff want them, we'll make sure that they get them.
And you think we'll have enough for staff? Is it now that if I'm a staff person, I get that mask from you? Mm-hmm. I can only wear it that day?
That's my understanding, yes. It's once and done.
Wow. It's a lot of disposal. A lot of masks.
Now,
But-
not every staff member will want this level. Some prefer to keep them, but what we've decided is that if a staff member requests this level of a mask, we'll provide it. I feel like that's our obligation.
Yeah.
As a school division. Now, what we will say at this point is we won't provide the N95s. We have not ordered any of those. I just feel like we should leave those to the healthcare professionals. But if a person wants to purchase their own N95s, we certainly, they can wear any mask that they want to wear. We just encourage them, if they do purchase those, to get them fitted properly.
Okay. So the next thing of discussion is, what if this motion doesn't pass? Okay? And you're going to have parents who rightfully believe that they can send their child Monday per the EO. What are we going to do about that if it doesn't pass?
That's a challenge I think every school division who hasn't passed some decision one way or the other is facing, and I think that's our principals, administrators, and teachers. They're waiting for us to provide them with some direction. We're having conversations about that. We are not going to suspend students or arrest students for not wearing a mask. I think that goes counter to what we are as a school division. We're here to educate students. Our hope is that we could rationally have conversations with students and their parents. If the decision isn't made tonight and whatever the outcome is, that we work together again to move forward. If the student's mask is something like, the gentleman mentioned the ears and a rash, we'll work with them maybe to find a mask that doesn't do that for the child. But we would just ask right now, this is about parents and students and the school division working together, that if the decision is that we remain and keep masks in place, that we work with families to honor that.
Yeah, because staff are concerned. Half of them, at least, in that survey that was sent to us later.
And I mean, the opposite is true too. We also don't want to put a child in a position where they're trying to do what their parents have told them, and then the child ends up in tears. That's not what we want either. That's not what we are about. But at the same time, it's got to be a partnership. We have to work together. The only way that's going to be resolved is that we work together and we come to some resolution to that, where we work with them. Either they get a different kind of mask, we provide them with additional mask breaks, we can provide them with that shield. I know nobody likes it, but that's an option still that's on the table.
And I think another thing that you've got to consider if this passes is the threat of bullying and criticizing. A child, their parents want them to wear a mask, they wear a mask, the kids are, because it's happened the other way around too, right?
Absolutely.
So we
And it'll
always got to be
happen both
mindful.
ways.
So that's definitely a conversation that needs to be happening with all of our children,
Absolutely.
with this being a change.
And we're prepared to do that.
Mind your own business.
And parents need to make that clear. Somebody's wearing a mask, that's okay.
God
That's
bless.
their choice. Don't you be saying anything,
Yep.
and vice versa. Parents need to make that clear at home as well.
Partnership, we're in this together.
Yeah, it
All
is.
of this takes
It is.
both of us to work together.
It can't be a one-sided situation. That's not how it works.
And that's what I liked about Dr. Switzer presenting. He said, up front, I'm not here to share my opinion. Like what he does in his practice, he gives the info and allows people to make their own informed decisions. And I like to point out too that I like that he said that they found it was over 99% of exposures just there, that they said that they were predominantly at home and with community contact. We can't control what happens when they go to Walmart or ball games or out sleigh riding or at a friend's house at a slumber party. I'm sure they're not wearing masks there. Their parents have made that choice. And when I disaggregate things from the survey, District 3 looks like 85% want that parent's choice. So I'm with you all. It needs to be a partnership. We need parents' help. If you want to be allowed that choice, we need your help in making sure that you're helping us not spread anything by sending your kids to school sick or giving them the little dose of blue medicine, like you'll feel better by lunch, mommy has to go to work. I mean, I was a principal and a teacher and I saw that happen. And we just need your help. If we need to make this work, it is a team effort. And Dr. Fox, I appreciate that you're so composed and respectful and calm. Not everybody could sit there and do that. I certainly could not. So I appreciate that, and that you focus on conflict resolution and ways that people can respect each other and get their opinions across, but do it in a respectful manner. And I appreciate that. So thank you.
Thank you.
I mean, based on just thinking about Dr. Switzer's presentation, though, would we be a little more prudent to wait until the transmission rates were a little bit better? Should we take that into account at all?
I agree with that statement. I think that's valid. I support that. I mean, we're sitting at a 42% positivity rate right now, right? Depending on how you look at the Page County data, we're roughly around 50% vaccinated, which is, 25% lower than the state of Virginia? So we have low vaccination rates. We have a highly contagious variant that's spread aerosolally. And we have a 42% positivity rate. And it seems like Omicron is peaking. So wouldn't it make sense to wait 3-4 weeks as some of these?
But don't we have to vote on option one since that's what was,
Yeah.
I understand.
We'd have to vote that down.
I get that. I understand that.
Yeah.
I was just sort of feeding on what you said.
I mean, what you're asking is a logical question. It really is.
I mean, it just,
And the thing we don't talk about, or Dr. Switzer talked about it a little bit, is the strain on the medical system. So if, the school's going to be a big driver in the community if Omicron spreads more rapidly in the school. So they're already strained. So that's another consideration. So we need to think about the greater good too, the community's good.
Well, and I think it goes back to particularly with people with at-risk health conditions. They really need to, and that's one of the good things about our county, that vaccination is up around the 70%. Because I'll just tell you, if my mom had it, my mom would have passed away if she hadn't have taken things the way that the doctors recommended. So that's a whole nother consideration with it as well.
Sure. You're right. Absolutely. You want to take a vote?
so do we want to move forward with a vote and then,
Got
we have to.
another?
okay, yep.
Okay. Let's take a vote.
No.
Yes.
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 No. So is there another motion then?
Just passed.
No, we just passed that one.
We just passed it.
So that motion,
Option
option
one.
one.
Option one. The motion was on option one.
That's right.
Seconded, and we discussed
It
it
was all
and voted.
option one.
Okay, so may I interject?
Yes.
All right, so now that you've passed that, what we will have to do is we'll craft our communication to families, to staff. We'll outline those bullet points. I was asked to have tonight a draft for you of a potential opt-out form, and I simply have to say I didn't get to create one. I will get that out as quickly as possible. We will have it vetted by our attorney. And we will push that information out as quickly as we can to families. What's going to happen is this is going to be much like what happened with the mask mandate in August. If you recall, we then pushed out on the Friday before school started the accommodations. And it required parents to act over the weekend. So it will push that form out and we'll push that process out for parents on how they will notify us through that opt-out form that they wish for their child not to wear a mask to school. And we'll do our best to answer questions from families and as they come up. I know one that we will get, there will be some families who might ask us, can they now move their child to remote learning? Because they prefer, or their child might be immunocompromised, and this is the point where now they want to make that decision. We will have instructions for them on how to do that. We are set up and ready and prepared to make those transitions for any families that need it. The other might be true. We might have some families who decided to use remote or virtual learning at the beginning of the year because of the mask mandate. Those families may request to come back. We will have a process for them as well in terms of how they do that re-enrollment with us for in-person learning.
Will the form be a hard copy, or will it be on the website somewhere where it's easier accessed and moved?
I'm hoping to make it electronic because that is easier, not only for parents. Most parents will always have a paper copy available, but it's easier for us in terms of record keeping if it's electronic.
Okay.
So let us process through that in terms of, we've also reached out to a couple of other school divisions who have pass the same motion, just ask, have they already developed a form? Some divisions are requiring it, some are not. Our preference is to have that so that we can ensure that our teachers know who isn't and who is, just so that they can help. Again, we're not going to interrogate any child or make them uncomfortable, but we're going to try to honor and respect parent wishes. And I'll just say to our staff too, we'll make these masks available. We'll push out information about if there's a preference for someone who wants an air purifier in their room, we'll push out that information. And when we hear something, if anything changes with the DOLE standards in relation to staff wearing masks, we'll push that information out. But
Will that be in 30 days?
my understanding is he's requested a report from them within 30 days, so we were told they were meeting this week, but I don't know that for sure. So within the next 30 days, there should be something. I don't know what it'll be, but something. So as soon as we find out, we'll share that information.
What impact do you think it'll have on the teachers with regards to people taking extended leave or even quitting?
I mean, I hope our staff don't do that. I hope what they'll do, again, just like we have a partnership with our parents, I hope that our staff will have a partnership with us, and let's work through what accommodations they might want or need to help them feel more comfortable. We talked, some people had asked for plastic shields, and, air purifiers is something we can offer, the N95 masks. We'll do everything we can to work with those teachers to help them feel more comfortable in their rooms, if this is a concern for them.
Now, on the air purifiers, I sent you early when we were talking about,
Yeah.
we were talking about this, I sent you stuff.
Yeah.
And, Dr. Gonzalez, I talked to her over the holidays, and she sent me some things as well, what they use where she's at. They look like they're fairly decent things. And we just got one in our home. It's an air doctor. And our two daughters came in this past weekend, not one sniffle or coughing or sneezing. So I think at least that thing appears to work. But usually every time they're just congested, and now it's
We've asked, there's a school division that's had them in place since last year, and we've asked them to share with us the brand and to have our staff talk with their staff about how are they holding up and what's the process in terms of changing the filters. And the other piece for us, that's just a reality of our world, is electrical outlets in classrooms is often a little challenging. So we just ask staff who want one to be patient with us in terms of, we may have to do some things electrically to be able to have that run and not blow a circuit or blow a fuse in some of the classrooms, but we'll work through those issues. We'll use ESSER funding to cover the cost of the purifier and the masks.
And then Timmy had one where there was a unit we were going to put them possibly in the commons.
Yeah.
Did we do that?
We held off on that for now, but we have the money set aside in the ESSER 3 for those. We were trying to connect with another school division that had them, and we wanted to give it a little bit of time to see was it really working, because they're quite expensive. But again, we've got it funded in ESSER 3. It was approved there, so we'll likely go ahead and move forward with those as well.
Board member discussion then?
Okay, I need to do this for our one speaker that we had tonight. She immediately emailed us, and then she replied to me again because I said, I'll make sure you know. Miss King that made the statement, come with guns loaded. She wants to apologize for the way she phrased the statement. Again, she doesn't like to speak off the cuff. I in no way meant to imply all guns loaded as in actual firearms, but rather all resources I can muster to make sure that my children get to attend school without masks. My sincere apologies for my poor choice in words. I replied and said, thank you. I'll make sure the rest of the board knows. And then I got another reply. I'm absolutely mortified. I would never do such a thing. I was only speaking figuratively, as in notifying the press and creating a social media stir. Nonetheless, I'm beside myself. I've already contacted the sheriff's office to explain myself. I never meant to imply I would show up with actual firearms. I'm not a dangerous person. I'm not a threat. And I'm so very sorry for the way it came across. So she wanted you all to know that wasn't her intention, even though with the mannerisms, you might have taken another way.
Any other discussion?
So, frankly, with Omicron surging, this executive order couldn't have come at a worse time, right? I mean, in terms of timing, in terms of what we're facing, right? So I'm really worried about our students and our staff and our community. And I mean that honestly. And I'm really disappointed with this decision by the board. Very disappointed.
Well, Ms. Cooper, I don't want to argue with you, but we've done the masking thing. We've done all these things and it's still, and the virus has changed twice on us. And we did this thing for all these many months and it's still where it's at. And we're not even in school. I mean, since out of the last 30 days, we probably went to school maybe 5. It's not like the school is spreading. You know, the sheriff's department, they're shut down, but they've been working. You know, one like it was a Christmas, they did take a Christmas break and then took snow days off. I mean, it's a very contagious thing.
Can I have a motion to adjourn?
I make a motion to adjourn.
So,
From Dr. Painter and a second from Mr. Painter to adjourn. Mr. Cooper.
Yes.
Mr. Ryan Taylor.
Yes.
Mr. Painter.
yes.
Dr. Painter.
Yes.
Mrs. Cody.
Yes.
Yes. The meeting is adjourned.